you have you would have the opportunity to play the recordings back for our own benefit. All right. So just as we all know, or during the introduction, we learned that in OSCE we have two main scenarios. I believe that one, um, so far we all know that in OSCE we have two main settings that our scenarios may come, right? So we have the community and we have the hospital setting. So these two are the main settings that our scenario comes. So in OSCE, it's either your scenario is a hospital-based scenario or community-based scenario. So with them, everything is the same, just some slight differences between the approach. And as we move on, we'll be discussing those differences. So in implementation station, we also have these two main settings, community and hospital. And according to the paper chart that we use in OSCE, there are two main charts called the medication administration record charts. Medication administration record chart. We have two main types of them. We have that for the community and that for the hospital. So as we move on, we'll be making or we'll be differentiating the two. Other than that, about 90% are the same or runs through both of them. Just some slight differences. Please, I believe you are on the same page.
Yeah.
So implementation in OSCE is 15 minutes a PI station where you are going to administer basically oral medications to your patient. So implementation station in OSCE is 15 minutes API station where you are going to administer oral medications to your patient. So as the OSCE some 23 demands, when you start this station, you still need to start from your scene safety, provide privacy, do a quick handle, and then you read your what scenario. After reading the scenario, to know the word and who you are, you approach the patient and introduce yourself, explain your purpose of visit, and gain consent. After all this, you need to do what? Do what we call the ID checks. We all know that. And then you proceed to do your what? Your pre-checks. So after your pre-checks, then you hand over the call bell to the patient. That is if you are in the hospital settings. In the community, after your pre-checks, you tell patient that you are going to prepare yourself. They should shout your name for help. From there, you proceed to do what we call WHO handle, where you verbalize the steps. So I believe this thing, we are all aware of it. Every clinical skills or every station in OSCE, with the exception of the silent one, you need to start from this point and end at the WHO handle. Please, is that clear?
Yes.
Yes, please.
All right. So in implementation, after your WHO handle, okay, you need to make some verbalization and then you proceed. So here in the UK, most of us, I believe we've seen, when you go to the hospital, the medications are stored in a locker or trolley called the medication trolley. So in OSCE, you need to, after your WHO handle, you need to verbalize that your trolley or your medication trolley has been cleaned. No, sorry. You need to verbalize that normally your medication trolley is closed or is locked, but now it is open for you to use. Is that clear? So you just make this statement and then you proceed. After that, you start to read your prescription by starting from this first page. Please, is that clear? I believe you can see my screen. So after your WHO handle and verbalizing that your trolley is locked but now it is open, you open to this page and then you start with prescription reading. Please, you start with what? Prescription
Reading.
reading. You start with what? Prescription reading.
Prescription reading.
So let's go back to the first page to do something before. So we all know that you check your scene safety, you provide privacy, you do a quick handle. So after the quick handle, then you read this page. Please, is that clear?
Yeah.
So can someone help us read the instructions below the scenario for us? talk to the person, blah blah blah. So the scenario is there. You need to read it for yourself to know the kind of patient you are going to deal with. Exactly. So sometimes the scenario even gives you some fair knowledge about some of the medications you may meet. So please, you let's start from the scenario itself, and then we're able to grab it better from that end. Exactly.
Yes, please. Please administer and complete the documentation of their 1400 hours medication in a safe and professional manner. Oh, the screen. And in accordance with the NMC standard. Scenario. Maria Madra has been admitted to the acute medical unit with shortness of breath, wheezing, and chest tightness, and has been diagnosed with pneumonia. She has got a background history of hypertension, hyperlipidemia, ischemic heart disease, hypothyroidism, and type 2 diabetes mellitus. Talk to the person, verbalize what you are doing and why to the examiner. Read out the chart and explain what you are checking, giving, not giving, and why. Complete all the required drug administration checks. Complete the documentation and use the correct codes. The correct codes for non administrations are on the chart. Check and complete the last page of the chart. You have 15 minutes to complete this station, including all the required documentation. Complete all sections of the document. Assume it is today and it is 400 hours.
All right. Thank you
1400
very much.
hours.
So this is your candidate briefing. Basically, your instructions as a candidate. Is that clear? So you need to obey whatever that is written here. So we'll be coming back from time to time to explain bit of them, one after the other. Okay, as the need arises. But for the meantime, let's take notice of the time. So it means that according to our scenario, our due time for medication administration is what? 1400 hours. Is that clear?
Yeah.
So that is the time that is due for you to give patient their medication. So let's take notice of that. So after your WHO handle, you start to read your what? Prescription. So in reading the prescription, you need to start from the top. So at the top, we can see that they have written hospital medication prescription and administration record, right? So you
Yeah.
start by reading hospital medication prescription for, then you mention your patient name. And then you state that all details has been what confirmed, or all demographic details or personal details of the patient has been confirmed already. You are saying they have been confirmed already because you have already done ID check in your introduction. Please, do you remember?
Yeah.
Good. So because you did the ID check earlier, when you are reading the prescription, all you need to say is hospital medication prescription for Maria Maja. All demographic details has been confirmed. So the demographic details you are saying they have been confirmed are the name, date of birth, and then the NHS or hospital number. Please, is that clear? So you will not repeat them what again. All you need to say is that hospital um medication prescription for Maria Maja. All demographic details have been what confirmed. All right. So after reading or saying hospital medication prescription for Maria Maja, demographic details confirmed. You ask the patient to confirm for you the height and weight. So you read out the height, the weight, the body surface area, and you ask patient if that is correct, and then they will tell you that yes, that's correct. After that, you need to read the word, the date of admission, consultant, and date of admission, or to the hearing of your patient and your assessor. Please, is that clear?
Yeah.
So basically, you read everything at the top there. The height, the weight, you confirm with the patient. Then you read the body surface area, the ward, date of admission, consultant, and then what? Date of time of admission. So this is how it goes exactly. So you start by saying hospital medication prescription for Maria Majai. All demographic details has been confirmed. Maria, can you please confirm your height and weight for me? Your height is 1.50 meters and your weight is 53 kg. Is that correct? And then the patient will answer you. Body surface area of 1.49 meters square. Ward acute medical unit. Date of admission today. Consultant Dr. B. Spears. Time of admission 900 hours. Please, did we get that?
Yes, please.
That is how
Yeah.
you read the top there. Okay. Then let's come to the next box. So the next log or the next box is titled in the green color. All prescribers must complete the signature record. Please, have you seen that space?
Yeah.
So
Mm.
that log or that space or that box is the documentation space for doctors or prescribers who prescribe medications for the patient. Okay, so they have to write their documentations there. So in OSCE, when you get there, just say prescriber's details are present or prescriber's log is complete. As simple as that. When you get there, just mention that prescriber's details are present or prescriber's log is what? Complete.
Complete.
Please, did we get that point?
Yes, please.
Yes, please.
Then when you are done, you move to the next table and also titled Details of Person Administering the Medication. So this part is for you and I, nurses. We need to do our documentation here after giving the medication to the patient. However, in the initial stages, we don't have to write anything because we have not given the medication. So you leave it and proceed. Later, after giving the medication, this is one of the areas we need to do our documentation as nurses and nursing associates. Is that clear?
Yes, please.
Please, do we understand?
Mm-hmm.
After that, you move to the red section part. So the red colored part is giving you alert. That is talking about the allergies of your patient and their effect. So when you get there, you read what the patient is allergic to and the effect. And again, it has been confirmed by a doctor. So you read the doctor's name and every detail, the day that it was confirmed. And you state that there are no medication risk factors if there are none. So you basically read what is in the red what space. Okay, which talks about the allergies of the patient. If there are no allergies there, still it will be confirmed by a doctor. Okay. So if it is a community, it will be doctor's name, number, and date. But in the hospital, just as we can see on our screen, it will be confirmed by doctors whose signature will be there, blip number will be there, and date will be there. So this is how you read it. Allergies, penicillin, effect, anaphylaxis. Latest, effect, rash. Confirmed by Dr. B. Spears. Blip number present. Confirmed today. Please, did we get it?
Yes,
That's
please.
how you read that part. You read what is there and the doctor that confirmed it. Then the last red rectangle down there is titled Medication Risk Factors. Pregnancy, renal impairment, impaired oral access, blah blah blah. So if any of them is ticked or marked, then you talk about it that oh there is medication risk factor, pregnancy. But normally in OSCE, nothing is ticked. So you have to say there are no medication risk factors. Please, is that clear?
Yeah.
So I'll quickly take it from the top and then you understand how to deal with this page. Then if you have any question, you ask before we proceed to the next page. Okay.
Yes, please.
So after a WHO hand gel, you need to verbalize that your medication trolley is always locked, but now it is open for you to use. And then you proceed to read your prescription. So you flip to this page. Hospital medication prescription for Maria Maja. All demographic details has been confirmed. Maria, can you please confirm your height and weight for me? Your height is 1.50 meters. Your weight is 53 kg. Is that correct? Body surface area of 1.49 meter square. Ward acute medical unit. Date of admission today. Consultant Dr. BSPS. Time of admission 900 hours. All prescribers' details are present. Allergies. Penicillin. Anaphylaxis is the effect. Latest, the effect is rashes. This was confirmed by Dr. B's PS. Blip number is present. It was confirmed today. There are no medication risk factors. Please, did that make it quite clear?
Mm.
So this is how you deal with this page. So after this page, you need to flip to the next what? Page. When you flip to the next page, again, you need to verbalize that hospital medication prescription for Maria Maja or demographic details confirmed. So with this statement, you'll be saying it every page that you open. You will be what? Saying it every page that you open. So the moment you flip the page, your first statement should be hospital medication prescription for, then you mention your patient name. All demographic details has been what? Confirmed. And then you go to the headings. So one of the differences between the hospital and the community is what I'm coming to state here. When it comes to the two charts, the community one is very simple. It doesn't have various sections. When we take the hospital one, just as you can see, okay? So the one that I'm showing now is hospital. So with the hospital, it has different sections, such as one's only medications, prescribed oxygen, antimicrobials, regular medicines, um, as required medications, infusions. This is what I mean by sections. So with the hospital medication chart, it's quite complex because it has various sections on the charts. Please, do you understand what I'm trying to say?
Yes, please.
On the other hand, with the hospital, community, with the community scenario or chart, it is very simple because it doesn't have various sections. In the community, you are basically going to administer medications or regular medications for your patient. So there are no what sections of the chart. Unlike the hospital, you have various sections such as once only medications, antimicrobials, regular as required. Please, do you understand the difference now?
Yes, please.
So in the community, this is how it also comes. Just once, like this. Very simple. So the community is mostly about 2 or 3 pages, and then everything is done. So this is a community chart. Very simple. So it's also at the top on the second page, it's also the same thing with the hospital one. So you do the same thing, exactly. So here too, you start by saying community medication prescription for Sonatra Franklin. All demographic details has been confirmed. So Sonatra, can you confirm your height and weight for me? Then you mention it. So here you mention the address of the patient, the GP address, and the GP, just as we did for hospital um scenario where we mentioned the doctor's name, that's the consultant, the ward, and the time of admission. Do you remember?
Yes.
You do same for the community. And again, you come to the next table, prescriber's details are present, the same thing, and then the allergies. Please, do we get the point? So you see this one, at the allergy part, there's nothing there. So you need to say allergies, none known, confirmed by Dr. P. Wright. Number present, confirmed today. Please, did we get it? So that is how you treat this first or second page of the medication chart. When you come to the community, it's just simple, just as I said. Okay, there are no sections. So all you need to do is to administer medication that are what? Due at your time. You need to do what? Administer medication that are due at your time. So looking at our community scenario we have here, What is our due time of medication administration?
800 hours.
Pardon.
800 hours.
8 hours.
All right. So our due time for medication administration is 800 what? Hours. So in this case, when we go to the chart, all we should be looking for are medication that are due at what? 8 and nothing else. Please, do we understand?
Yeah.
When you come to the chart, you should only be looking out for medication due at 8, and then you go according to the script. If it is not due at your time, don't waste your time on it. Please, is that clear?
Yes, please.
Good. So let's go back to the hospital where it's quite complex and it has various sections. So you flip to the next page and then you have your what? Chart. So you read the headings in the green color. So for the first log or for the first table, the heading is what? Once only what? Medicines. Please, can we see that?
Yeah.
Once only medicines. So with the hospital administration record chart, there are some rules that govern each section of the chart. There are some what? Rules that governs each section of the chart. That is what makes it a little bit what? Complex. Because every section there is a way you need to approach it. Okay. So when we take once only medicines, it has this rule that when you get to this place and only at this place, when you get to what? This place and only at this place, you should be looking out for medications that are due at your time, or and start doses that were prescribed not more than 2 hours before your due time. Let me take it again. When you get to this section, once only medicines, there are two types of medications you are looking out for. One, you are looking out for medication due at your time. So in this case, our due time is what?
1400 hours.
So when we get to once only medication, we should be looking out for medication due at what? 14. And also start doses that were prescribed not more than 2 hours before our due time, which is 14. So what does it mean? It means that if a start dose was prescribed at 12 o'clock or 1 o'clock, we can still give it at 2 o'clock because it has not exceeded what? 2 hours. Please, did we get that?
Yes, please.
That is what you should be doing at once only medication. So let's look at our chart. We have this set of medications there, okay? So looking at it, which of these medications can we give as per what I just explained? If you didn't get what I explained, I said when we get to once only medications, you are looking out for medications that are due at your time, and also start doses that were prescribed not more than 2 hours before your actual time. So in this case, our time of medication is 1400 hours. And I'm asking which of these medications or prescription would it be valid for you to administer when your time of administration is what? 1400 hours.
Look
Clarithromycin.
at time.
Lysine, losartan, and levothyroxine.
Losartan, levothyroxine, clarithromycin.
Do you agree with them or you have another opinion?
Correct.
I agree. I
Pardon?
agree.
I agree. Please, who doesn't understand why they are saying we can give losartan, levothyroxine, and clarithromycin? Who doesn't know or understand why they are saying that? All right. So it means all of us do understand perfectly by this rule that we should be looking out for medication that are due at our time and start doses prescribed not more than 2 hours. So we what all know. So once you get to know that the prescription or the medication that is there is due at your time and it is okay for you to give, you need to do or what? Read prescription. You need to do what? Read the
Read the
prescription.
prescription.
So you said losartan is due at our time, or we can give safely because our time is 14 and it was prescribed just an hour late. So we can give. So this is how we read the what? The prescription and then dispense. So you start by saying um hospital medication administration for what? Maria Maja, all demographic details confirmed. Once only medicines. Then he starts. I'm reading losartan. Okay? So he starts. Date today. Drug losartan. Dose 50 mg. Routes per oral. Instructions start and OD. Time required is 1300 hours. Prescriber's signature and bleep number is present. Time of my administration is 1400 hours. I confirm that this prescription is valid and safe for me to administer. And then you are done. So I'll take it again. Hospital medication prescription for Maria Maja. All demographic details has been confirmed. Once only medicines. Date today. Drug losartan. Dose 50 mg. Route per oral. Instructions start and OD. Time required 1300 hours. Time of my administration 14. Prescriber's signature and bleep number is present. I confirm that the prescription is valid and it is safe for me to administer. This is how we read it. Please, is that clear?
Yeah.
So, according to our script, we are learning that when you read one prescription, you pause and then you go and administer the medication, and you go and dispense the medication, and then you come back and continue with the rest of it. Please, is that clear?
Yeah.
So now that we have gotten to know or we've read the prescription for losartan, you go to your medication trolley and then you pick your losartan. So here in the eco or in the exams, the medications are arranged in alphabetical order. So there's no stress in locating the medication in the medication what? Trolley. So you go to the trolley and pick your medication. When you pick the medication, there are some information on the medication bottle, of which you need to read it out and validate your what? Medication. So you go to the medication trolley and then you pick the medication bottle and then you read what? The information on the what? Medication. And what are the information? It will be it will be the name of the medication, the expiry date, and batch number. So you see, we read prescription for losartan, didn't we?
Yeah.
So you go to the trolley and you pick drug losartan, 50 mg, expiry date 2020 what? 8. Batch number is present. Assessor, I confirm that this medication is valid and it is safe for me to administer. I take it again. After reading the prescription, you go to the medication trolley and pick the medication, losartan. So you state that I have with me losartan, expiry date 2028, batch number present, and the strength is 50 milligram. It is safe and valid for me to what? Administer. Please, did we get that?
Yeah.
Yeah.
After reading this, the next thing is for you to what? Dispense the medication according to the dose given to you in the prescription, isn't it?
Mm-hmm.
Good. So in our prescription, the said patient is taking how many milligrams of the losartan? 50 mg, right?
Yeah.
And the medication also comes in 50 mg. So you pick your medication pot and you state or you compare this with the prescription. So you state that Maria is taking what 50 milligram, and this tablet also comes in 50 milligram. Therefore, I'll have to dispense what one tablet onto the lid of the medication bottle. So you first dispense it on this what
Education lead.
good before you transfer it to the medication pot. The rationale is that let's say you are picking or you are pouring one tablet and you mistakenly pour excess of let's say two. You can pour it from here back to the what? To the bottle. But you can't pour medication from here to this place. Once it gets here, it doesn't go back here. Please, do we get the point? That is why you need to what? First dispense it onto the lid. So that in the case where there are excesses, you can send them back. Is that clear?
Yes.
After dispensing the medication, do it like this and place it on the trolley. Place the medication pot and the bottle together like this on top of your what? Medication trolley. And then you move to the next prescription. Please, are you following?
Yeah.
Yes.
So somebody should do us the favor and read the next medication prescription for us. Hello.
Hello.
Drug, levothyroxine, dose 100 microgram, route per oral, instructions, start and OD, time required 1300 hours.
Derek, how are you back?
Please, are you done?
Yes, something.
Are you sure?
Oh, prescriber signature and name present.
Can you please take it again?
Okay, I'll start from the head. Do I need to start from the head again?
Just the prescription.
Okay. Date today. Drug levothyroxine. Dose 100 microgram. Route per oral. Instructions. Start and OD. Time required 1300 o'clock. Prescriber signature and name and book number present.
All right. Well done. So you shouldn't end there. You have done well. So after reading all those information, you haven't done anything without saying you have confirmed or
Mm,
you confirm that the prescription is what? Valid. Because you just read it. You are not telling us anything. Do you understand?
mm,
So after reading
okay.
it, you have to let your patient know that, oh, this prescription is what? Valid. So I'm happy to give the medication. Do you understand? Other than that, you have not done any other thing. It's like you have just read what you saw. What does it mean to your patient, or how is it relevant to your patient? Do you understand what I'm trying to say? So after reading it, you need to end by saying, I confirm that the prescription is what? Valid. And therefore I'm happy to what? Administer. Is that clear? So again, you go to the medication trolley and you go and look for what? The medication of the prescription you read. And what medication did we read?
No, that's so good because I did the second one.
So you go to the medication trolley and pick your what?
Mm.
Levothyroxine.
Levothyroxine.
Again, you mentioned I have with me here levothyroxine, 100 microgram, expiry date 2026, batch number present. Then again, you state that the medication is safe for you to what? Give. Please, do you understand?
Yeah.
So you are doing all this verbalization to let the assessor know that you are checking what? The right drug, okay? And then the validity or the safety of the drug that you're going to give to the patient. Because on the ward, you not verbalize all these things. You just have to use your clinical judgment to know. Do you understand what I'm trying to say? Because on the ward, you are not going to explain to anybody that you have levothyroxine 100 microgram. But that is what actually you have to check before you give the medication to the patient. I believe you all know that.
Yes.
As nurses and midwife,
Yeah.
you can't give expired
Can you
medication.
guys sit down?
Hey,
You,
Can you sit?
okay.
Can you sit down?
oh yeah, because you know what a woman adds. She puts
All right.
on the
So you
pad
pick the bottle and then you
pad
verbalize the name, the dose,
between her legs.
the strength, the expiry date, and the batch number. And again, according to our
And
prescription, the
that
patient is
takes
taking how much
away
of the
the scar.
levothyroxine.
100 microgram.
And this comes in the
Yeah.
strength of what?
And that takes all
100
the
microgram.
100 microgram.
So how many tablets are we taking?
One.
One.
Pardon?
One.
So in this case, you pick what? Your medication pot, and then you dispense one tablet onto the lid of the medication bottle before you transfer it into the medication pot. So in OSCE, every medication goes into a separate what? Pot like this.
So you want to say if there are 10 medication, they'll be in 10 different pots.
Yes.
Wow.
What is the rationale behind that?
There's no rationale, but that's how we do it.
Wow.
So the only clinical rationale I can give you is during OSCE, when you're about to give the medication to the patient, you need to explain the side effects and the indications. So if you mix them, you wouldn't know which medication is this and which medication is that. Is that clear? So we separate them like this so that when you are giving, you know that this tablet is this tablet is that. Is that clear?
Yeah.
Yes.
All right. Can we proceed?
Yes, please.
Good. So you dispense into separate pots every medication you take. Is that clear? All right. So you read the prescription, you do what? You dispense and place them like this on your trolley. Please, are you on the same page?
Yes, please.
Good. So someone will also read the third prescription and then we are good to go. Is that clear?
Yes, please.
The question.
Please, let's finish with the third one and then you bring in your questions, okay? Can someone read for us?
Date is today. Drug is clarithromycin. Dose is 500 mg. Route is per oral. Instruction is STAT and BD. Time required is 1400. Prescribers details are present. Time given is 1400. I can confirm that my prescription is valid and safe to administer.
Okay, good. But read it again. Remove the is.
Time is today.
Ah,
Time today.
Day to day.
Day to day.
Day today. Drug clarithromycin. Dose 500 mg. Routes per oral. Instruction. Start and BD. Time 1400 hours. Prescribers details are present. Time given 1400 hours. I can confirm that my prescription is valid and safe to administer.
isn't this simple?
Simple.
Good. And the time given, just say your time of administration, exactly. Because at that point, you have not given the medication. So it's better to
Okay.
say time of administration is what?
1400.
1400 hours. Then you
Thank
confirm the
you.
prescription. Again, you go to the medication trolley, take your clarithromycin, and then you come and dispense, just as we did with for the other two. And then you place it on the trolley. Is that clear? So at this point, please let's pay attention at this juncture. I'll continue and explain basically the whole implementation process. And then after that, we come and discuss the various sections properly. Do you understand what I'm trying to put across? What I'm trying to say is, at this point that you have dispensed our medication, I'll explain the rest of the process you need to go through to finish your implementation station. Is that clear? Then later we discuss the implementation stations, the various sessions properly. I hope I'm making sense here. Hello.
Yes, please.
All
Yes.
right. So far, we started from scene safety, provide privacy, everything to WHO handle. After the WHO handle, you stated that your trolley is locked, but now it is open, isn't it? After that, we started reading our prescription from this page. Do you remember? Good. After this page, we came to this page where we dispense our medication. So you continue with other what pages of the chart until you get to the last page. Okay, until you do what? You get to the last page. So by the time you get to the last page, you would have dispensed all the medication that are due at your time, isn't it?
Yeah.
Good.
Yes.
So let's assume we have gone through the various pages of this chart and we have dispensed our due medication. Have you understood up to that point?
Yeah.
All right. But before that, someone wanted to ask question. I nearly forgot. Please ask and let's go.
Yeah, so I wanted to ask if you would dispense all the medication, maybe written that is being prescribed on the trolley before you administer. You go and come, like that for all these medications before you administer to the patient. Thank you.
You not go and come anywhere. You are at the same place doing the same thing. So you not go and come anywhere. Okay. Like you are standing at the same place where your patient, your trolley, everything is okay.
Okay.
Do you get it? All right.
Okay, thanks.
So you read the prescription, you dispense, you read, you dispense, and then so now you have dispensed all our medications. So after dispensing all your due medications, there are three things you need to do. There are what? Three things you need to do. One, you need to do what we call second ID check and then allergy check. You need to do what? You need to do what?
Second ID checks and I'll let you check.
Second ID check. So second ID check simply ask the patient to tell you their full name and what? Date of birth, and also ask them if they have any what? Allergies. Confirm again if they have any what? Allergies. Please, is that clear? So that is the first thing or one of the things you need to do after dispensing your medications. Two, you need to ask for what? Swallowing difficulties. You need to do what? Ask for swallowing difficulties. So if your patient has any swallowing difficulties, that may require you to crush the tablet and mix with yogurt for patient to swallow. You need to do so. So after dispensing the tablet, you need to ask if your patient has any swallowing difficulties. Third thing is to ask your patient if they would like to take their medication in bulk or one after the other. So that also explains the rationale why we dispense the tablets separately. So if your patient would like to take their medication in bulk, you go according to their wish. If they like to take the medication one after the other, you do so. So you give this, then as they take it, you give this one, they take it in that format. Please, is that clear?
I have a question.
Yeah.
Please, is that clear?
Yeah.
All right. Your question.
You did mention that you asked if they have difficulty in swallowing. and if so, you can just add it to a yogurt or something. Would that not come under COVID medication, which needs the approval of the prescriber?
You said
So you said if they have difficulty in swallowing the tablet, so you can help them crush it and then maybe add it to yogurt. So I'm asking, would that one not amount to COVID medication, which needs the approval of the prescriber or the GP before you can do that?
so. If it's that case, you follow the protocol as you are saying. But what we are learning is you give alternatives. That's what you want us to understand. Do you get it? So
Okay.
if the medication cannot be crushed, then obviously you need to explain in other ways that is possible.
And with COVID, the patient is even hospital.
Do you get the point?
Okay.
All right. So don't worry about that aspect. Let's You are learning like you mean when you ask them there's difficulties, you find another alternative to give the medication. That's what we are trying to understand. Exactly. All right. So you ask these three things before you give the medication to the patient. You do first second ID check, swallowing difficulties, and then whether they would like to take their tablets in bulk or one after the other. Please, is that clear?
Yeah.
Then after this, you proceed to give the medication to the patient. And in giving the medication to the patient, the rule is you need to state the indication of the patient, indication of the medication to the patient, and then some possible side effects of the medication. So you pick the medication, okay? So it states, "Hi Maria, this is losartan for your blood pressure. Some of the side effects may be what? Nausea and vomiting and abdominal cramps. If you experience any, don't hesitate to what? Press the call bell for assistance." That is if it is hospital. If it is community, maybe Maria, this is losartan, your blood pressure tablet. Some of the side effects may be what? Severe headache or dizziness. If you experience any of these, don't hesitate to call your GP. In case of emergency, you call 999. That is if you are in the community. Please, is that clear? So it is mandatory for you to tell the patient the indication and some possible side effects of the medication you are giving to your patient. If you don't do that, it's a straight fail. Please, do we get it?
Yeah.
So in this case, in the exams, they have given you all the options or all the, how do I even put it? Whatever resource to help you know medications you don't know. Even prior to the exams, I'll send you a couple of medications that normally comes in OSCE, and then you read around it to know their indication and possible side effects. On the exam date, there will be a tablet. There will be what? A tablet. And that tablet contains an app called the British National Formulary, BNF, which is a software that contains or helps you to know medications and their side effects. So after here, especially those of us in the UK, we can only have access. If you are outside the UK, you cannot have access to the BNF. You download the BNF and then you search for the medication. So in the exams, there will be what? A tablet with the BNF for you to search for medications you don't know. So you have no excuse to give a wrong indication of a medication to your patient. Please, do you understand?
Yeah.
So if you don't know the medication, in the exams, you can make use of the what? The BNF. However, when did it expire? However, it's very good for you to learn it before you go. Because when you know the medication, you will not spend time or waste time by searching the BNF. Would you? No. So we all know as nurses and nursing associates that paracetamol is an analgesic, isn't it? So when you meet paracetamol, would you need to search before you tell the patient that it's for pain? Obviously not, because you know it already. So I always advise that download the BNF, search for the common drugs in OSCE, and know them so that you not be found wanting on the exam day to, search the BNF. So before we proceed, we'll take some few minutes and learn how to use the BNF so that when we download, we'll be able to look out for some medications. Please, is that clear?
Yes.
So just mention a name of any medication. So when you open the BNF, when you download it newly, it will ask you to register. So register as a nurse. Is that clear? And then that's it. You are good to go. So please let's mention just one medication, and then we use it to learn how to use the BNF.
Nifedipine.
Nifedipine. That's what I'm saying. Good. So you see, it has come. Nife what? Dipine. You click on it, it will come like this. Nifedipine. Scroll and look out for what? Indications and what? Dose. We also have contraindications. We have side effects. Please, can we see that?
Yes.
Good. So to know the indication or what nifedipine is used for, or do you understand? You click for indication and what? Dose. So it will tell you the various conditions that nifedipine can be used to what treat. So we have Raynaud syndrome, we have angina prophylaxis, we have what? Postponement of premature labor, hiccups in palliative, chronic inner fissure, blah blah blah. But the popular use of nifedipine is use of anti what? Hypertensive.
Antihypertensive.
Do you get it? Good. So it fits the second what? Um use. Do you understand? Good. You go back. If you want side effects, you click on what? Side effects. And they'll give you some common side effects of the medication. So if the first time of hearing the word or seeing the medication, the nifedipine in the exams, please take your time and use the BNF. So that when you are giving the medication to the patient, you tell them this is nifedipine for your what? Blood pressure. Some of the common side effects is what? Drowsiness, nausea. If you experience that, don't hesitate to let us know by pressing the call bell. Please, is it quite clear?
Yes.
Yes, sir.
Any other medication?
Levothyroxine.
Levothyroxine. Levothyroxine sodium. Good. You go to indication and dose, isn't it? So it's for primary treatment of what? Hypothyroidism. Please, is that clear? So you know that it's used for what? Treating hypothyroidism. Some of the side effects is what? Diarrhea, fever, anxiety, headache, and the rest. And yeah, so this is how we use the BNF. So those of us in the UK, please download it. Please, is that clear?
Yes.
Yes, sir.
You can get it on Google Play Store and Apple Store. Good. So now you've dispensed your medication. You've done the three things, which are what? You've done the three things, which are
Mhm.
hello,
Second
Your
ID checks,
second ID
allergy,
check.
and swallowing difficulty checking.
and what?
ID checks, swallowing, and allergies.
Is that all?
And then if
And asking if the patients want the medication in bulk or one
Or one after the other.
after the other.
All right. Then, after asking these questions, the next line is to give the medication to the patient. So, when you are giving the medication to the patient, how do you go about it?
So those who may take it together, I think you will have to check if they have really taken it, as some of them may tend to swallow it. So
No,
if
we are asking if when you are giving, how do you go about it? That's the question now.
oh, okay. when you're administering the medication.
Mm-hmm.
So if they want to take it together, like if you have separated them when we're explaining it to the patient, then I think it needs to go in the same one pot and be given to the patient.
Okay, so when you are giving, how do you go about it?
You give a patient maybe a fluid or a glass of water.
Of their
So
choice.
do you ask the patient, would you like to take it with maybe juice or water first, or you want your medication first?
Do you have juice?
Water.
So don't ask, just present what you have. Okay.
Okay. Okay.
So you've not answered my question. So if you are giving the medication to the patient, how do you go about it?
So do you give him the container of the
Okay, you
medication to
you you would
swallow?
assess the patient's position when the person is lying. You prop the person up, like in a sitting up position. Or
That's not what I'm looking for, though.
Eh,
But thank you. What did you say when you are giving the medication to the patient? What do you do? That's what I'm asking.
Okay. Gentlemen, may try a share.
Okay.
Maybe you ask the person, would you like water first or medication before water? Eh?
It's not the same thing they are saying. I'm saying
No.
You said
You
we should show the
confirm patient
medication.
details.
you have done that.
Okay.
Okay, and then you have to explain the medication, the side effects, and everything to the patient.
That's what I'm looking for. I said when you are giving the tablet, what do you do?
no,
So you
that's
take
learning there.
no.
Okay.
Why ID second ID check? Why swallowing? Why if they were taking bulk? From there, what do you do? Okay, let me put it that way. You are done with second ID check. You have asked for swallowing difficulties. You have asked if patient will take it one by one. They will say yes, they will take it one by one. How do you do or go about it from this point?
Okay, so you let patients know reason for taking the medication and the side effects.
That's what I'm looking for.
Okay.
So you take the medication, let's say the low losartan. So, Maria, this is low losartan for blood pressure. Side effect may be this, that, and that. That is how you go about it. That's the question I was asking. Is it clear now? Or I was the one confusing you?
You were the one confusing also.
Confusing is because after doing the BNF, I thought we were done with that. So
But my question was, after the three things, how do you go about giving the medication?
okay.
Anyways, so that was what I was looking for actually. Good. So you give the medication, stating the indication and the side effect, and then after giving, there's one crucial thing you need to check that the gentleman said earlier. After giving the medication, before you document, you need to confirm that your patient has what
Swallow.
swallowed the tablet. If you don't do that, it's a straight fail. If you don't confirm that your patient has swallowed and you document, that's a fail. So it means your patient hasn't taken the medication, but you have documented that it's been taken. That's not safe. Do you understand the point? So you need to ask the patient to open their mouth for you to check or have a look to confirm that what the medication is taken before you take your pen. So in implementation, all that you have been saying, you don't take your pen. Your pen should lie down because when you pick your pen and write anything, it's considered you are chatting before giving the medication. So in OSCE during implementation, you don't take your pen until you have given the medication to the patient and you have confirmed they have swallowed. Is that clear?
Yes.
Yeah.
So you give the medication, you offer water, they swallow, you confirm. Then you thank them for their cooperation and tell them that you are going to what? Do your documentation. So After giving the medication, there are three places to do documentation. There are what? Three places. Please let's pay attention, which is very important. One is this place. Candidate what? Name. You need to write your name on the first page of the medication administration chart. Candidate name. Please, are you following?
Yes.
Yeah.
Then you flip to the next page. You go to the log. Details of persons administering the drug. Do you remember this place? Earlier when
Yeah.
I said something. That is where you, the nurse, you document your details that you have given medication to the patient. So the top one is for doctors or prescribers, and then details of person administrator is the what? Nurses. So you need to do what? Write your name, your initials, signature, and then base. What is the base? The base is the current word. The underlying word is what? Current. The base is the current word of your patient. How do you get to know the current word of your patient? Go to the top left side of the chart where they have written word and date of admission. Can we see?
Yeah.
So the word is the current base of your patient. So you copy whatever that is there. That is in this case acute medical unit. Always when you're looking for the base, don't copy what someone has written already. Come to this place, the top here, and look at the word. If it is community, it will be what? The GP address. Is that clear?
Okay.
If it is community, it will be what? The
The GP
GP
This
address.
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 So you see the community, the GP address will be your what? Base. Can we see North Road Primary what? Care Center? That is here. Not the full address. The first line of what? The address. Is that clear? That is your base. Please, do you understand the point?
Yep.
Mm-hmm.
Good. So please, after giving the medication, that's the second place you need to sign. And the third place you need to sign is where the prescription of the medication is. The third place you need to sign is where the what?
The
The prescription
prescription
of the medication is. So earlier on, we dispensed and gave losartan, isn't it?
Yeah.
So this is how you document. And in the documentation, there are two dynamics or two forms when it comes to the two settings. Please let's pay attention. When you give a medication to a patient in the hospital settings, this is how you document. You document by writing your initials and then date of your administration. So just as we see here, the ASK is someone's initials, and then 21st of June 2024 is the day he wrote the exams or gave the medication to the patient. Please, is that clear?
Yes.
So
Yes.
when you give a medication to a patient in the hospital settings, you document or chart by writing your initials and what? Date. Please, do we get it up to this point? Hello.
Hi.
When you give a medication in the hospital, this is how you sign. Your initials and what? Date. Please, is that clear?
Yes, please.
On the other hand, in the community, when you give a medication in the community, this is how you sign. You write your initials, date, and then time of administration. You write your what?
Date.
Initials, date, and time of what? Administration. Like this. So the due time for this candidate's administration is 8 o'clock. So when you give the medication, if you look at the heading, given by, sign, date, and what? Time. Can we see?
In what medication? In what category?
Community.
Okay.
In the community, you add the time. So the basic rationale is so let's say the medication is supposed to be given to the patient at 8 o'clock, and maybe due to traffic or one or two reasons, you got to patient's house 8:45. If you give the medication at 8:45, you have to write the time you gave the medication against your signing. Do you understand? You don't have to write the 8 o'clock that was supposed to be given, because obviously you didn't give it at 8. Did you?
Mm-mm.
No. So that is why you write the date in addition to your signature and date in the community. So the only difference between the hospital and the community when it comes to the signing is the time. Please, is it clear?
Yep.
Yes, please.
Again, when you don't give a medication to a patient in the hospital settings, this is how you document. You write the code, your initials and date. You write the what? Code, like this. 10 ASK, then date. This leads us to coding. Good. Coding in OSCE or in medication administration station simply means that. So before we go to coding, is there anything we need to know about the what? The documentation in the community and the hospital before we enter into coding?
Gentle, I wanted to ask regarding this as required medication. We know paracetamol mostly fall under that category. So, under as required medication, let's say your time you're supposed to administer medication.
Have we talked about as required medication today?
I don't know.
Hmm?
No.
So let's get there first. Is that okay?
Gentle.
Yeah.
Yes, madam.
And please, the one solely medication, the last one, I think the claritomycin. I realized at the pharmacy check there was no signature appended. Please, what about that one?
So the only thing that can invalidate a prescription is prescriber's signature and blip number.
All right, thank you.
If pharmacy check is absent, it's still valid.
All right, sir.
So the only thing that can make a prescription invalid is what? Prescriber's signature and blip
Lip
number.
number.
So it means nobody prescribed the medication. So how can you give? You understand?
All
Yeah.
right.
So pharmacy check does not invalidate a prescription. Can we please move forward?
Mm.
Coding simply means representing a reason for omitting a drug using a certain number. So on the medication chart, there's a space called medicine on administration and self-administration. So can someone read what is written? If a dose is blah 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 for us, then we continue from there.
If a dose is omitted for any reason, the nurse should enter the relevant code on the administration record and sign and date the entry.
Good. This is simply telling us that if a medication is due at your time, I repeat, if a medication is due at your time and for a reason you are omitting it, you need to code it during your signing or your documentation. So the coding simply means they've assigned the reason for omitting the medication to some specific numbers 1 to 10. So you use the numbers on the chart instead of the what? The reasons. So you could see the numbers from 1 to 10, right?
Yeah.
Good. So if you're omitting a medication due to any of these numbers, then when you are charting, you write the number, which is the code, your initials and date, that is in the hospital settings. In the community, you write the number, initials, date, and what? Time. Please, do you get it?
Mm-hmm.
So let's say you are giving a medication to a patient, and then you realize that a start dose has already been given. When you are charting this medication, okay, because if a start dose has been given, can you give again? No. Do you get the point? So it means you'll be omitting that drug. Do you understand up to that point?
No, please come again. I'm quite confused.
So you are going to give a medication and you saw that a start dose of that same medication has been given. Would you give that medication?
No.
So what would you do? It means you omit it, isn't it? Hello.
Yes.
So if you're omitting it, what is your reason for omitting it?
That was given.
Good. So when you are chatting, you can't write the full phrase start dose given in the chat. That's why it has been assigned with a code, which is number what?
5.
Five. So you write the 5, your initials and date. So anybody who picks that chart will see that okay, this nurse didn't give this medication because of this reason. And the reason is that start dose has already been what?
Given.
Yeah.
Is it clear?
Yes.
So you're going to give a medication to your patient and you get there, you check the blood pressure. So you have losartan, which is anti what? Hypertensive. And what does it do? It reduces blood pressure, isn't it?
Mm-hmm.
You are going to give losartan, you check your patient's blood pressure, and then it is 90/50. Are you happy to give?
No.
So to know that, or to let others know that you didn't give losartan because your blood pressure of the patient is low, is that you use code what?
Code 9.
So in your chatting against losartan, you write 9, your initials, and date. That is what we mean by coding an omitted what?
No.
Dose of a medication. Do we understand up to this point?
Small.
Pardon?
Small.
You said
I said small. I'm still on that start dose given.
make it big. So that is it. So we have 10 codes or 10 reasons for omitting the medication. 1 to 9 are specific. 1 to 9 are what? Specific.
Specific.
So with 1 to 9, they have their specific what? Reasons. 1 to 9 have their what? Specific
Specific. Yeah.
reasons. And then 10 state other. Other means if your reason for omitting the medication is not among 1 to 9, you have to use code 10. If your reason for omitting the medication is not among 1 to 9, then you are free to use code what?
Code 10.
10. So code 10, popularly in OSCE, that comes under it is allergies and contraindications. Allergies and what? Contraindication. For instance, you have an asthmatic patient and there's a prescription for ibuprofen. Ibuprofen is contraindicated in what? Asthma. So you don't
Asthma.
have to give. So when you are coding, you need to use code what? 10.
10.
Because contraindication is not part of 1 to what? 9.
9.
Allergies is also 10. Because allergies is not part of 1 to what?
9.
9. But if your patient refuse the medication, there's a what? A particular what number for it, isn't it?
Yeah.
If your patient is known by mouth, there's what? A number for it. Please, do you understand coding?
Yes.
So,
Gentle, please, can you go over a little? I don't get it very well.
what
Um,
what
um,
don't you get?
for example, so when you go to the exams hall, and they give you like losartan, you're administering losartan. Will you check the BP before you give?
You will ask the assessor.
Oh, okay, okay,
Is that what you don't understand or you don't understand coding?
it's okay, Thank you.
No, answer my question, please.
That's the question I want to ask. Then I see if I really understand. I'm okay now. Thank you.
So, do you understand coding?
Yes, it's okay.
It's not, it's okay. I just answer my question, darling.
Yes
Do
or
you
no?
understand coding?
I am not
If you say it's
so.
okay, it means other things.
No, I don't. I understand, but it's not fully like 50% of it.
It's
I
not
don't.
sticking yet.
So what
Yeah.
don't you understand so that we address it? Is it too much to ask for?
No.
No, please, no, no.
That's why we are here. So what don't you understand?
And also, I wanted to ask that the coding. So when like the form you've put in on the screen, I saw that they've ticked some places. Is it already ticked, or you will tick when they give it to you? I don't get it.
You don't take anything. This is for someone's learning and they take.
Oh, okay,
You don't take anything.
okay, okay. Thank you.
You you didn't answer my question, or you rather ask me a question. Anyways,
She
let's move
understands.
forward.
So
Okay, good. So that's what we mean by coding. Good. So when you are coding, you write the number, your initials, and then date in the hospital settings. In the community, you write the number and then your what? Initials, date, and then time. So after coding a medication, you still need to go back to the last page of your medication chart. There's a box or a log there, which is titled omitted doses of medicine and delayed doses. So the medication that you coded in your prescription, you have to copy that same prescription and come and what? Write it here. And so you write the date, the time, the drug, the dose, the route, the instruction if given. If not given, leave it blank. Then reason for omission or delayed more than 2 hours. So when we go to, let's use this as an example, coamosiclav. We all know that coamosiclav is a penicillin containing drug, isn't it?
yeah.
Yeah.
And when you come to this chart, our patient is allergic to what? Penicillin.
Penicillin.
That is why the nurse didn't give what? Coamosiclav here. Is that clear?
Yeah.
So what's the reason for him to omit it? Allergies, isn't it?
Yeah.
Mm-hmm.
That is why he used code what?
Code.
10.
10.
10. So now that he has coded here against the coamosiclav, you still have to write a prescription of coamosiclav at the back here. Please, do we get it?
Yeah.
Yeah.
So you copy the prescription of coamosiclav and place it here. And then the reason why you omitted, this time around, you write the actual phrase. Do you understand?
Yeah.
Yeah.
So on the chart where you are documenting it, you write the code, that is the number. But back here, you write the actual reason. So if you omitted it due to start dose giving, you write the reason where, what? Start dose giving. If you omitted it because patient refused, you write patient what? Refused. But on the chart itself, you need to use the what? The code. Please, do we get the difference?
Mm-hmm.
Again, there's another prescription that this nurse didn't give, salbutamol. So let's look at salbutamol. So this is salbutamol prescription. It was saying that there was no prescriber signature and what?
Bleed number.
Plate number. And that makes the prescription what?
Incomplete.
Incomplete. When you come to the code, what is the number for prescription incomplete or unclear?
6.
6. So the nurse will need to code the medication what? By writing 6. Okay, where is it? Good. That's why he did this. 6 initials, ASK, and date in the hospital settings. Is that clear? Then
Mm.
after coding it this way against where the prescription is, you come back to the last page here and write everything. And then the reason for omitting is what?
Incomplete prescription.
That is how you go about it. Coding of omitted doses. Please, is there any question?
No.
Yes, the question. for the antihypertensive, for example, so if do we ask for the blood pressure before we dispense or we dispense before asking?
Someone just asked.
Yeah, you ask the assessor. We will get there though. You ask the assessor exactly. So before we get to the sections, let's address this and you proceed. So there are some special rules governing some medications. Please let's pay attention. It's very, 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 very important.
Sorry, gentle. Please, I
Yeah.
didn't get the explanation for the is it instructions?
Ins- what is it, please?
At the latter part where you make your document. Yes.
Instruction is given in the prescription. So for instance, this metoclopramide, no instruction was given, isn't it?
Mm-hmm. Oh,
So
okay.
if you are to copy it here, you leave it blank. But
Mm.
for the coamosiclave, instruction was given as what? For chest infection. You
Okay.
see,
Okay.
indication or instruction for chest infection. So that's what you are talking about.
Okay. Thank you.
So there are some rules governing some what? Medications. And you need to know them. This one is not taught in OSCE or like you presume as a nurse or nurse associate, you should know. Please, is that clear? And these are rules that govern some common medications in OSCE. One, antihypertensive, just as our sisters were asking. On the clinical settings, before you give antihypertensive to your patient, you need to check the recent vital observations of your patient to know the what? The current blood pressure of your patient. Is that not what we do?
Yes.
Fantastic. So in the exams, when you see that this medication is an antihypertensive, you need to ask the assessor the current blood pressure of your patient. Please, is that clear?
Yeah.
And then they will tell you within normal limits. Then you proceed to dispense the tablet and then you do the rest. So with antihypertensives such as losartan, nifedipine, candesartan, um, lisinopril, all the drugs antihypertensive that we know, you need to ask the what? Blood pressure of your patient before you give. If you don't ask, it's a fail because it's considered that if you were to be on the clinical settings, you wouldn't check the recent vitals of your patient. You will give the drug and your patient will die. Do we get the point? Are you there?
Wow.
Hello?
Aye.
Yes.
Becoming tough now, agent. So
You said
it's becoming tough.
there's no other way out. So we need to strengthen your muscles. Is that clear?
Mhm.
So you need to ask the current blood pressure of your patient. That is antihypertensive. Next one is what? Anti-diabetic. That one too, you need to ask the blood glucose level of your patient before you give. Just as in the ward or on the ward, before you give maybe metformin, linagliptin, or all those what anti-diabetics, you need to check the blood glucose of your patient. Is that not what we do?
Yes.
So in the exams, you need to confirm or ask the assessor the current blood glucose of your what? Of your patient. Please, is that clear?
Yeah.
If you don't, it's a straight fail. The next thing is proton pump inhibitors, such as esomeprazole, omeprazole, lansoprazole. These medications should be taken 30 minutes before food. I believe we know that as nurses and nursing associates, don't we?
Yeah. We
Good.
do.
So before you give lansoprazole, you need to ask the patient if they have eaten. If they have eaten, you still have to give. But you need to educate them that subsequent doses, they should what? Take the medication 30 minutes before they eat. Please, do you understand the points? We are discussing special what? Information or rules governing some what? Medications. So we've talked about antihypertensive, antidiabetic, and we are now on proton pump inhibitors. So the three main common one that comes in Oski is esomeprazole, lansoprazole, or omeprazole. I think omeprazole is quite popular among us, isn't it?
Mm-hmm.
So good. And here in the UK too, they use lansoprazole a lot,
Yeah.
coupled with omeprazole. So these are the
So
two that are
for
very.
family.
So you need to ask the patient if they have eaten. Another drug which is also popular among these is levothyroxine, the one we just searched. It is also a drug that should be taken on an empty what?
Stomach.
Stomach. So you need to ask patient if they have eaten before you give levothyroxine. If you don't ask before you give levothyroxine, that's a straight fail for you. No two ways about that. Exactly. You need to ask. They are very straight on that. And again, paracetamol. So before I touch on paracetamol, let me touch generally on analgesia. With analgesics, there's a rule that analgesia should be given at an interval of 4 to 6 hours, at least. This simply means that when you give an analgesic, it should take 4 to 6 hours before you can give the next what? Dose. Exactly. Please, do you understand up to that point?
Yeah.
For instance, you give ibuprofen at 12 o'clock. You should give ibuprofen again after 4 p.m., which is after what? 4 hours. Please, do we understand up to this point?
Yes.
So this rule applies to. Hey, you don't want to mind me. Don't. It's not me that you are. I'm making it. That's how it is. So please, don't angry. Don't be angry at me. That's how it is. Okay. Are we here?
Yes.
Yeah, we are here.
Mm. So you need to do what? Look out for that. Analgesia should be given at an interval of 40. So in Oski, what they do is at once only medication, let's say they'll give IV paracetamol there, let's say 1100 hours, and your due time is 14. And then at regular medicines, they'll prescribe paracetamol again. So from 11 to 14 is how many hours?
3 hours.
11 to 14 is how many hours?
3
4 hours.
3
Hello?
3 hours.
3 hours.
So are you to give your regular paracetamol?
No.
No,
No.
So in that case, how would you code it?
too soon.
Start dose giving.
Start
Hey.
dose giving. Do you get on hundi? Start
And am
Mm,
dose
I
giving.
confused?
Exactly.
yeah.
Good. Because you are omitting it because you check the once only medication and a start dose of paracetamol has been given at 11 and your time is 2, which is just 3 hours. So you can't give paracetamol again. Paracetamol, another rule that governs it is the drug-drug interaction. The most common drug paracetamol interacts with when it comes to especially what's is cocodamol. So you all
Mm-hmm.
know that cocodamol contain elements of paracetamol and what? Codeine.
Coding.
So you can't give paracetamol, and then if it is not more than 4 hours, you can't give cocodamol. So when you give cocodamol, it should be after 4 hours that you can give paracetamol again. Do you
Mm.
understand? The same thing applies to cocodamol. Pardon?
Mm-mm.
What is it, please?
No, nothing. Just go ahead.
So if you give paracetamol, the next time you can give paracetamol again is after 4 hours. The same thing with what? Cocodamol. So cocodamol also contains codeine. So they also interact. So when you give cocodamol, you can't give codeine until it's after what? 4 hours. But you can give two different analgesics together. For instance, you can give
Codeine
uh-huh.
and
Continue.
paracetamol together.
What?
You can give codeine and
Codeine
paracetamol.
and paracetamol.
That's cocodamol.
Like, you can give them if they are separate. You can give them together.
What again?
Also,
Ibuprofen and
But why
paracetamol.
gentle? Gentle. But why is it that when they give you paracetamol in the hospital, cocodamol in the hospital, they tell you not to take in paracetamol again because cocodamol contains paracetamol.
That's what we are
That's what
That's not
saying.
he's
what I
saying
said.
now.
I said codeine and paracetamol, not cocodamol.
Ah, okay.
All right, so it means we understand that. Good. So
Yeah.
another rule governing paracetamol is weight. So according to the prescriptions, a patient who weighs less than 50 kg should not be given 1 gram of
One
paracetamol.
gram. Yeah.
Yeah.
So
500 mg.
if your patient weighs less than 50 and there's a prescription of 1 gram, then that prescription is incorrect or unclear. So you need to code it as such with code 6. Please, is that clear?
Okay.
So before you give paracetamol, you should look out for these three things. One, the weight, check. Two, check the last time paracetamol was what?
Was
Given.
given.
Given. And check if cocodamol has not been also what? Been
Given.
given in the past. Before you give paracetamol, you should look out for these three things. Else you make a mistake that will let you fail. So when you see paracetamol prescription, the next thing you should do is to go to what? One solely medication and see if patient has not received any paracetamol. Please, is that clear?
Yes.
Yeah.
Good. So these are the special rules when it comes to some medications. Now let's go to the various sections. So we dealt with um once only. Let's go to prescribed oxygen. So this chart, every page you flip, you verbalize the topic, isn't it? Hospital medication prescription for so and so demographic details confirmed. If it is community, you state community prescription for so and so demographic details confirmed. Please, I believe you understand up to that point.
Yes, please.
Good. So hospital medication prescription for Maria Maja demographic details confirmed. Then you read prescribed oxygen. So here, all you need to do is you read prescribed oxygen. Then you say Maria is not a CO2 retainer because it has been taken. Is your patient a CO2 retainer? No, it's take, isn't it? So you
Yeah.
say Maria is not a CO2 retainer. When you come down, you see they've take target oxygen saturation 94 to 98. That's the one they have checked, isn't it? So that is the target saturation of your patient. So you need to ask the assessor the current saturation of your patient. And then the exam, the assessor will tell you it is within normal limits. Then you say that there's no prescription for oxygen. Then you flip to next page. Very simple. So that page, all you need to do is to read hospital medication prescription for Maria Maja, demographic details confirmed, prescribed oxygen. Maria is not a CO2 retainer. Assessor, can you please confirm for me the current saturation of Maria? Simple as that. Is that clear?
Yeah.
Are you okay with
We'll
that?
be all right.
Um, so um, so if the assessor says within normal range, you proceed. What if the assessor give you a figure that is outside the normal range? Let's say less than the normal, or in oxy, they won't tell you, they won't give a figure outside the normal range.
They won't give you a figure outside the normal range in implementation.
Okay.
Exactly.
Yes, please.
Implementation, you are there to give what? Um, oral
Oral.
medications. So there
Okay,
won't
okay,
be administration of oxygen. Exactly.
okay. All right,
Where
all
there will
right.
be
Thank you.
oxygen administration, there will be a prescription. Then in that case, they will let you know that it is not within normal range. Then you proceed to give oxygen. Exactly.
Okay, yes, please.
All right. Then you move to the next what page. The next page, the topic there is what? Antimicrobials. So you read hospital medication prescription for Maria Maja, demographic details confirmed, antimicrobials. Again, when you get to antimicrobials, the advice I give is go back to the allergy part. So let's all go back and check if there is any penicillin allergies. If you check and there is a penicillin allergy, then that should guide you that during your antimicrobial sections, you should be careful the kind of antibiotics you do what you give. However, when you come to the allergy sections and there's no penicillin allergies, then you are in a free range to give any antibiotics that is prescribed and it is due at your time. Do you get the point I'm trying to put across?
Yeah.
Please come again.
Okay, if I'm coming again. So, what we are saying is when you get to antimicrobials, to be safe, not to administer an antimicrobial that your patient is allergic to, come to the allergy section of your patient chart, which is this page that we are seeing. Can we see?
Yeah.
So in this case, our patient is allergic to what?
Penicillin.
And letters. So going into the antibiotic section, it is at the back of your mind that your patient has penicillin allergies. So you shouldn't give any antibiotic that contains what?
Penicillin.
Penicillin.
So you are on guide. Do you get the point?
Yeah.
Mm-hmm.
On the other hand, when you go and check and there's no penicillin allergies, then you are free to what? Administer any antibiotics without fear. Are you getting the point?
Yeah.
That's what I'm trying to say. So there are a list of what? Antibiotics that are safe to administer when your patient is allergic to penicillin. And when your patient is what? When your patient is allergic to penicillin. So if your patient is allergic to penicillin, all these antibiotics are safe for you to administer. Is that clear?
Yeah.
So normally in OSCE, the most common one that comes and confuses people is clarithromycin when you have pre or post-op. That is either ectopic pregnancy or hernia repair. You have prescription for what? Clarithromycin. And many people don't give clarithromycin because they think it's a penicillin what? Containing drug. Clarithromycin is not what? A penicillin containing drug. Such clindamycin, gentamicin, metro, they are not penicillin containing drugs. So they are safe to give if your patient has penicillin what? Allergies.
Oh,
Please, is that clear?
oh,
These medications are
no.
not safe to give when your patient is having what? Penicillin allergies.
Penicillin.
Please, can we see that?
Yeah.
Coamuziclav, ampicillin, benzyl penicillin, temocillin, peptas, penicillin V, all of them contains what? Penicillin. So normally in OSCE, the common one they bring is what? Amoxicillin and what? Coamuziclav. Is that clear?
Yeah.
So if your patient is allergic to penicillin, then you shouldn't be happy to give what? Coamuziclav when it is what? Prescribed. Please, is that clear? Hello?
Hmm.
Good. So you take notice of it. So once you get to antimicrobials, go back to allergies and check. And then after that, the next thing is to what? Look out for your due time. If it is due at your time, you read the prescription and you dispense just as we did earlier. Okay?
Mm-hmm.
And then you move to the next one. What is Vasoprolol? What is it used for?
In some hypertensive patients,
It is used to control the heart rate also.
the heart rate. Okay.
Good. So if you have bisoprolol, what do you need to ask the assessor before you give bisoprolol?
The heart rate,
Pulse.
You need to ask both the heart rate and what?
The BP.
The BP.
The BP.
The same thing applies to what? Digoxin or digoxin, however you pronounce it. It's also a heart controlling what? Medication. So you need to ask the patient, the assessor, the current heart rate and the blood pressure. What about furosemide?
fluid.
Urine.
Like, I
Fluid.
think
Fluid
is
ret-
It's a diuretic.
reduce fluid retention.
Freeze
So
mind
what
is a
do you
diuretic.
need to ask anything before you give Freezimide?
Their blood pressure.
Urine
Anticoagulants.
output.
Urine output, blood pressure. Who else?
Furosemide. Is furosemide not an anticoagulant?
No,
Oh,
it's a diuretic.
Oh,
No,
is a diuretic.
tablets.
Furosemide.
It's
Furosemide.
the
Oh.
same as lasers. Lasers.
Oh yeah. It's an antidiuretic.
It's not
Diuretic.
anti. It's a
A
diuretic.
diuretic.
Oh, is it okay?
So you need to ask the assessor the blood pressure level of your patient before you give Furosemide. Do you agree?
Yep.
Yeah.
Who doesn't understand why we are asking blood pressure before we give Furosemide, please? Many people also fail because of this. Many people don't really know the connection between blood pressure and then Furosemide. So if they have prescription for Furosemide, they just give without asking blood pressure. If you don't, it's a fail. You're wondering why I keep saying it's a fail, it's a fail. Eh? It's not a joke. Oh. You will fail if you do that. Actually, that's the how it is. So you, as we go on, I'll show you feedbacks and you understand why I keep saying all these things. Still get the point.
Yeah.
Hello. Good. Please, who doesn't understand or know the connection between um blood pressure and freeze mind?
Me.
Good. So the boss one who said uh what do you call it? Blood pressure. Please explain to her.
So when you give Rosemary, because it's a diuretic, it's going to take a lot of fluid from the person. So if the person already have their blood pressure lower, and you're still going to take a lot more fluid, it means they're going to feel dizzy, and then it's very risky. And then if care is not taken, the person can have a high risk of falling or can injure themselves. That's the reason why you need to ask for their blood pressure.
All right. So just as he said, thank you very much, boss one. So diuretic has direct effect on what blood pressure because blood pressure deals with volume of what fluid in
Yeah.
your body. Do you understand? So
Yeah.
when there's a vast volume of fluid exiting your body, then obviously your pressure will drop. So it's not safe to give blood pressure freeze mind when you're good.
But
So please, I just want to share one feedback from a recent candidate and see like some of these things I say you fail. Some of you think that it's funny. Can someone read the one written in the yellow box for us? Implementation. I know it's not that clear, but try.
implementation, you fail to provide the patient with an explanation of what each drop given was for. You fail to check the integrity of the medication administered, including the expiry date. This is unsafe medicine management.
Please, did we get that?
Yeah.
There were so many errors in this one.
Pardon?
I meant to say there were so many errors in this implementation. Not only did the candidate not provide explanation for the drug, not check the expiry date.
But these are simple things, isn't it? I mean to say when I say you don't do this, you fail. You think maybe it's somehow, but that's it. This one, this is the reason why he went back to do the whole implementation again.
James, I have a question.
Yeah, officer.
There's a lot of things you have to explain. I have to do this, and as humans, you may forget one of them. So does it mean if you omit just one, you'll be penalized, and then you have to come and rewrite everything again?
Please, what did he miss here?
But well,
The expiry date
Yeah,
and
it's
all.
so for medication, I understand. Even in pharmacology, some masters will give you a negative one for scoring one. But like, if any other explanation you forget to maybe say, I have to do this just once,
That
means
one
you.
is per assessor's discretion.
Okay.
But the most aspect where they focus much or most is documentation.
All right.
Is what?
Documentation.
Documentation. So let me show you this as well. Anti-man. Yeah. That's why I always preach about what? Proper what?
Documentation.
Documentation. If you verbalize or do your script very well without documenting, this is assessment. Can you read the feedback for us, please?
You documented an incorrect frequency of monitoring observation for a patient scoring 3 in one parameter on the news. Competence was not demonstrated.
This is why this patient went back, or this candidate went back to write assessment again.
Oh,
Do you want more?
Wait, frequency of monitoring observations for a patient scoring 3 in one.
Can you read this one too for us?
In this station, you did not accurately complete the news 2 chart. Your escalation was incorrect. This is a patient safety issue and a documentation error. Please practice this skill prior to your receipt. Hmm.
So how many mistakes or how many things did they not do right?
one.
So you've answered yourself. So Oski is either 100% or zero.
No.
Okay.
It's 100% or what?
Zero.
Plus 90.
Zero. So please, you should be up. Yes, just as our gentleman said, there are a lot of things to grab. But on the exams date, calm down and ask yourself certain questions. Especially, you've seen a prescription for Coamosiclav, okay? It is due at your time. Relax. Ask yourself, okay, what is Coamosiclav? Fine, it is an antibiotics. Right. All right. So with antibiotics, some of them have penicillin. So let me go and check. Is my patient allergic to what? Penicillin. Oh, I want to check. My patient is allergic to penicillin. And I know that coamosiclav contains carbonucleic acid and what? Amoxicillin. And amoxicillin is also a penicillin containing what? Antibiotics. Then I'm not happy to give what? The coamosiclav that is due. So I have to code it. Do you understand?
Yeah.
So you need to ask yourself questions before you give the medication to your patient. Oh, you've seen prescription for paracetamol. Okay, what are the rules? You ask yourself, what are the rules governing paracetamol? Don't be in a rush and go and give paracetamol because it is due at your time. Do you get the point?
Mm-hmm.
Good. You ask, paracetamol is an analgesic. Oh, okay. Even with analgesic, there's a rule that it should be given at an interval of what? 4 to 6 hours. Then let me go and check if patient has received paracetamol anywhere. Okay, paracetamol too, they said you can't give 1 gram to a patient weighing less than 50. Okay, what is patient what? Weight. Do you understand? So when you do all these checks, there's higher chances that you give medication safely. Again, they have prescribed paracetamol for the patient. Don't assume that, oh, every patient or every adult is taking paracetamol 1 gram. So 1 gram is 2 tablets. So I'm giving 2 tablets. You will fail. First, check with your what? Dose that is given to you in your what? Prescription. Maybe your patient is weighing 45. So in this case, they have prescribed 500 milligram. So you need to give 1 tablet, isn't it?
Mm-hmm.
So if you write that, oh, any adult paracetamol is 1 gram, then you give 2 tablets, you end up giving overdose.
Okay, gentle. What about if it is a syrup and the prescription is 10 mils to 20 milligram? Would that leave you to your own discretion?
You need to calculate. If they say 10 mils to what?
10
20
to, no,
milligram,
like they'll be like administer, like some tablets will be like patient can take 10 to 15 mils 3 times a day. This one leaves it open that you can give from 10 mils up to 20 mils.
I know there's nothing there's no prescription like that.
Okay.
Now, wow.
Okay. So don't worry about it. that. So please, one thing is just activate all the senses around your clinical judgment when it comes to the OSCE. Do you get the point? Don't rush. So in OSCE implementation with the 15 minutes, the maximum number of tablets you give is about 3 or 4. So you have enough time to think through. Don't rush. If you rush, you make silly silly mistakes. So some of these mistakes that you are seeing, some of them are. It's not like they don't know. You let me play this pressure. Let me share this. This lady wrote it. This lady, I was just proud of her, even though she didn't get all on her first attempt, but she didn't get chance to come for the face to face. So we're doing everything online. She'll learn and let me know the shortfall so that I'll let her know. So I asked her what happened, and she explained. And according to the explanation, not that she doesn't understand or she didn't know, but because of pressure, it made her make some what mistakes. So let's listen.
You still need the and I'm quite pressure them so many
If you don't
moment
understand
I'm
the language,
around
don't
make
worry,
us a
I'll
fan
explain.
and my the escalation I want them say problem no cause maybe if you can make you know now the temperature 34.1 into now score near 3 and ni BP do so na and I'm 100 into then so your 1 till total score near 4 and I make I say oh try and so say so one parameter I score 3 escalation by 1 hourly nso ɛnora no menim deɛ ɛyɛɛyɛ meminya phone no na mehwɛ ayi sheet n'akyi nti 4 hourly no ɛna mede hyɛ hɔ na meka kyerɛ patient ne sɛ the total score yɛ 4 the total score yɛ 4 nti yɛbɛ monitor no every 4 hourly nti mepi abɔnten kɔ na mesaa bɛkae sɛ wosei sɛ 1 parameter score 3 a ɛne yɛbɛ escalation no yɛ 1 na kyerɛ sɛ hɔ naa na mehu sɛ But assessment pressure area and the minimum the me total yi minya 12 4 and a 1 1 sa nti and the minimum the ya ma fairly pressure area but assessment ni the I'm a junior assessment ho na me say junior implementation ho
Please, did we get that? We know, but sometimes the what? The pressure. So please, I know the exams give you what? A lot of anxiety, blah blah blah, a whole lot. But on that day, is do or die affair. Mm? Make sure that you just forget at that point, face what is in front of you. Do you understand? And leave other things to fight for themselves. So you need to let me see if we get another the feedback there, it be plenty, but not to scare you, but just where is it? Just for us to be on our I can't remember.
Gentle.
Officer.
I'm a bit curious. You said the patients are paid athletes. So you said you are going to give them medication. So are they going to take it or what?
They will not take.
Okay. Well, she said we should ask them to open their mouth to check if you have taken it.
So it's just let me how do I even put it? You are all acting. Let me put it that way. Okay.
Okay.
Yeah. So they will not take. When you say take, then the assessor will say taking, then you put it down. Then you take next one. Like that. They will not take the medication. They have been dead by now. The way that we have been giving them underdose and overdose there.
Gentle.
Yeah.
Please, this is not. It has nothing to do with what we discussed today, but with a single parameter thing. So, for instance, if a single parameter is say, let's say temperature is scoring 3, and you got maybe BP 1, pulse 1, you scoring 5, yeah. So with that, is the monitoring going to be hourly since only temperature score 3, or
All right. So
prefer
the how do I put it? The analogy that we use for single parameter scoring 3, making the frequency 1, is limited to when the news is what? 1 to 4. If it exceeds 5, or if it is 5, it has its own rule, which is also 1 hour, isn't it?
Yeah.
Good. So that analogy of one parameter in single what no, is limited to what, where the total news score is 3 or 4. Do you get it?
Okay.
But if it is 5 going, they also have their own specific monitoring frequency, and they
Yeah.
so you have used that one. One it exceeds 4 going, use the one assigned to it. So let's say you have a single parameter in scoring 3 and your total is 7. What is your monitoring frequency?
Continuous.
Good. Because 7 says continuous. The fact that one single parameter is scoring 3 doesn't make it 1 hourly.
Okay.
You get it? That
Yeah.
rule is limited to when the total news is 3 or what? 4. Do you
Okay.
understand?
Yeah.
Good. So can you read the feedback of this implementation as well?
I can't see.
Is the one below, the last paragraph below.
You feel this station, or it's not that one.
Yeah.
You feel this station as you made some medication errors. Firstly, you did. Yes. Firstly, you did not check or confirm the patient's allergy.
So patient allergy is part of the 3 things, isn't it?
Yeah.
Mm.
Good.
Status during okay. This is a patient safety issue and very crucial as you were administering medication. For your receipts, make sure you check the allergy status with the patient. Secondly, you administer the incorrect dose of analgesia to your patient, which is a safety issue. For your receipts, take care to read the prescription chart and
Ooh.
administer the required dose of medication.
There are loads and loads of them. So this one too had 9 out of 10. This is very hard, disheartening, and I can't work with it.
Exactly.
More. So please, let's be
Then
conscious about.
another question. Sorry, last one. With the planning, intervention, do you begin with the eye or you go straight with medicate, monitor? What?
You go straight.
Okay, thank you.
You're welcome.
Last question.
Okay.
During the exams, if you know you have omitted and you did not do anything, can you go back and rectify?
We have something we call acknowledgement of what error in OSCE. So when you make something within your time, you remember, all you need to say, assessor, I acknowledge that I should have asked for blood pressure before giving losartan. Assessor, I acknowledge that I should have asked patient about what their allergies before giving the medication. Assessor, I acknowledge that I should have cleaned what the injection port before giving the injection. Assessor, I acknowledge that I should have asked my patient about swallowing difficulties before giving the medication. That is a pass.
Okay.
That is within your time. So I remember it happened to me. My first, with your first station, obviously you'll be anxious. So if you don't stay, you don't maintain your steez, your doom will start from there. Because your first station, no matter who you are, you'll not be comfortable. Yeah. So I was very anxious and I was trying to control, which you can't, obviously. You just have to maintain some steez. So it was catheter placement of urine. I entered the room, the woman was showing me glove is here, this one is here, this one is here. Oh, and I'm truth be told, I wasn't hearing anything. I, I was just scanning my eye through the room. I don't understand what the woman is saying because a lot's on my mind. So I started the procedure. I finished the procedure with God being so good. I didn't wear apron. Throughout the procedure, no apron. So I finished early. I had 2 minutes. So I was standing there reminiscing, thinking about what I missed. And then I said, okay, I'll dispose of my clinical way. So I'm stripping off the apron from my chest. Then I realized that, okay, there's nothing there. So at that point, I have to what? Acknowledge that throughout the procedure, I should have worn my what? Apron. And that will come as a pass. So if you acknowledge your errors during your time, it's a pass. So they understand everything that because of pressure, anxiety, you may miss certain things. But the ability to remember what you have missed is also a plus. Do you understand? So they consider that. Exactly. But once your time is up, keep it to yourself.
Hello, Jensen. Um, did you say we can give medications like omeprazole? For instance, I know we are supposed to give like 30 minutes before meal. You say if the patient asks that the patient has eaten, you say we can still administer.
Yes, you can still administer and educate patient that with subsequent doses, they should what? Take it 30 minutes before food.
Is the same thing with the level thyroxine as well?
Yes, please.
Okay, thank you very much.
So all
Okay.
those questions you are asking is just to let the assessor know or to let you to prove that you know that you should be doing those tasks. Do you understand? So even
Yes.
on the ward, if you are going to give low tithing to the patient and the patient has eaten, you can't say you don't give it. Would you say you will not give because they have eaten? No, you will give, but you will tell them that tomorrow they should make sure what they take their tablet on empty stomach. Do you understand? So the same thing.
Okay, Jensen.
Yes, boss.
Yeah, please, about the implementation, the community session, you said after giving the medication, you write your initials, the date, and the time given. Then you have to write the time you gave the medication.
Mm-hmm.
And I want to ask, on the implementation, the front sheet, the first page, where you have the scenario and your candidate name and so. You see, when you come down, it says, assume it is today, and the time is maybe 16 o'clock.
Mm-hmm.
And you said you should give the time you gave the medication. So are you going to write the time you gave the medication? That's the community setting I'm talking about. Or
Yes.
just
Mm-hmm.
assume.
So that the time they have given you is the time you are giving the medication. So that is the time you write.
So you write the 16 o'clock instead.
Yes, that's your time of administration. So you are assuming that that is the time you are giving the medication. Exactly.
Okay.
So let's say if it is this, your time is 1400 hours. So that is when you are giving the medication. So that's the time you write. Okay.
All right. I got
So
it.
for instance, in this scenario that we have here, assume it is today and the time is what?
800
So when
hours.
the person was starting, what did he write?
800 hours. I understood that part, but when you said maybe when you have like you have to write the time you are giving in the community setting, maybe your medication is due at 8 o'clock.
Yeah,
8.
so in this exam situation, that is the time you are giving. There's that example I made. I was trying to explaining the rationale behind writing the time.
All right. All right.
That let's say in the actual sense, okay,
Mm,
you are supposed to give the medication at 8, but you go to patient house at 8:30 and you gave it at when? 8:30. Do you understand?
mhm.
So you need to write the 8:30. But in the exams, because no traffic will catch you, is the actual time you give. Do you understand?
Okay. I guess it's now.
That's it. So
Yeah.
don't worry about that. Just write your due time there as given in a scenario and you're good to go. So the another section that also confusing people is the what? As required medication. As required medication, when you get there, just as the name suggests, it's what? As required. Many people make mistake here. As required simply means when the patient needs it, isn't it?
Yeah.
Good. So when you get there, look at the medication that is there and know the indication of the medication. Then you ask the patient if they will need it. So here we have what? Cocodamol. Can we see? Hello.
Yes.
Yes.
Be mad at that. Yeah,
Yeah,
I'll be
wow.
fine. So cocodamol is what?
Analgesic.
So you ask the patient, Maria, you have cocodamol as the as required medication. Would you like to have it? If patient says yes, then you read the prescription and dispense, and then you proceed and give. Is that clear? If patient says no, you don't have to do anything. We don't code as required medication. We don't what? Code as
Oh,
required medication. We only code a medication that is due at your time, but for a reason you are omitting it. But as required medication is not due at your time. So if patient says they don't want it, you don't do anything. You just move on. You just what? Move on. Please, is that clear?
Yeah.
Good. So when you get there, look at the medication that is there. So another medication as required is what? Metoclopramide. What is metoclopramide? It's an antiemetic.
Antiemetics.
So you ask the patient, are you feeling sick or not sure? So would you like to have your what? Anti-sickness tablet as you've been prescribed what? Metoclopramide. Then if patient says they want it, you read the prescription and dispense, and then you give. And when you are during documentation, you write the time of your administration there because there's no time as required. So when you give is when you write your time. Do you get the point?
Yeah.
Many people in Oski, the popular, medication that comes at what? As required analgesia and antiemetic. When your scenario is end of life, you definitely have paracetamol or cyclizine or metoclopramide at what? As required. When you have a
Please
pain
come.
medic when you have a pain
Come.
med- when you have a pain medication at the as required medication, don't ask the patient, are you in pain? And then proceed to give the medication. That's wrong. Don't ask the patient, are you in pain? And the patient will say yes. And then you proceed to give. That is wrong. Why? Not everyone who is in pain requires pain medication. I hope we know that. Good. So when you ask for pain and the patient says they are in pain, you proceed to ask them if they would like to take their what? Paracetamol or the medication at the as required medication. Please, do we get it?
you are
Please,
really
can
in
you
pain.
mute yourself? We can't hear.
Yes, I want to ask a question.
Okay.
For instance, let's say they start medications, there was paracetamol,
Mm-hmm.
and then you come back to the as required, and there's paracetamol.
Mm-hmm.
So, maybe at the start medications, they've already given paracetamol, but it's not up to
Mm-hmm.
the 4 hours. So,
Mm-hmm.
do you realize the assessor that if like paracetamol was given at the start doses, and even though the patient has it at the as required medication, but looking at the time difference, it is not like it's not due. The 4 hours is not up. Like just realize to let her know that I don't know how to frame the question.
Yeah, trust it. So in
I
this
get to
case,
understand what I'm trying to
yes,
say.
yes.
Mm.
So in the exams, let me put it. Most of the time, you are not talking to your assessor. Is that the case? Do you get the point?
Yes,
In
please.
this case, you are dealing with your patient. So you are
Okay.
talking to your patient.
Okay.
So you get there. So maybe Maria, you have paracetamol at the as required medication. However, I checked your previous documentation and I could see that you have received paracetamol less than 4 hours ago.
Okay.
Okay. So I can't give you this one. So you need to wait for about an hour more before we can give you another one, paracetamol.
Okay. All right. Thank you.
So you explain to the patient why you are not happy to give another dose of paracetamol when it is not up to 4 hours, not the assessor.
Okay, okay.
So in this, you are communicating with your what? Your
Patient.
patient. So the assessor will only come in maybe when you are asking for blood pressure, sugar level. Do you understand? Or those kind of things. But everything you are doing, the candidate briefing says was read out the chart and explain what you're doing, checking, giving, not giving, and why. Do you understand?
Yes.
So you go to antimicrobial, so patient is having what? Coamosiclav. You need to read the prescription of coamosiclav and confirm that it is valid. Do you agree with me?
Okay.
Yes. The prescription is valid. But you will not give, or you will not be happy to give because coamosiclav contain what?
Yes, no.
Yes, Lord.
Good. So in this case, you tell your patient, you read the prescription and confirm that the prescription is valid. However, Maria, I'm not happy to give this medication because as per your documentation, you are allergic to penicillin, which causes anaphylaxis. And coamosclav also contain penicillin. So I'll not give. I'll review this prescription with the doctors. This one you are talking to who? Your
The
patient.
My
patient.
As simple as that. Your assessor
okay.
doesn't come in anywhere here. Your assessor is just listening to your conversation with your patient, and then they will assess you on that. Do you get the point? Yeah. So basically that is it. So when you get to ask required medication, look at the medication that is there. Ask the patient if they will need it. If they need it, you read the prescription and give. If they don't, you don't do anything. You just move on and go. Is that clear?
Yes. So my last question.
Uh,
Please, I joined late. Maybe you might have mentioned this earlier. You said what you read the prescription and confirm that the prescription is correct.
mm-hmm.
Is it that like as a candidate, do you have a document that you are going to like to check against the prescription, or there's a way of confirming that the prescription is correct?
All right. So know that your prescription is correct. You know that every prescription, I don't know. Every prescription must contain the 10 elements of the what? Right of medication administration. Hmm?
Okay.
Right
Yes.
patient, right dose, right route, right drug, right
Right
dose.
method of administration.
And then, so all these things are on the prescription. If any of them
Okay.
is missing, then the prescription is invalid. So in a case where, let's look at this prescription for salbutamol, okay? It has the right medication, isn't it? The
Yeah.
right date, the right
Mm.
dose, frequency is there, route is there,
Mm.
duration is there, time is there, start date
Mm.
is there, finish date is there. However, there's no prescriber signature and blip number. So this
Mm.
Okay.
makes the prescription invalid.
Yeah.
Mm.
Do you get the point?
Yes.
So that is how you get to know. So let's check the prescription for this drug, metformin. Everything is intact here. Do
Mm.
you get the point? From
Yes.
drug, right date, right dose, right route, duration, time, prescriber signature, and blip number, and name. Everything is intact. So this prescription is what?
Valid.
That's why they give. So in
Okay.
OSCE,
Okay.
the common trick they use when it comes to prescription incomplete is the elimination of what? Prescriber signature and blip number. Do you get it? So once
Yes.
the prescriber signature and blip number is not there, then obviously that prescription is what? Invalid.
Incomplete.
Because there
Okay.
can be a prescription without a dose. Then that's not a prescription. Do you get the point?
Yeah. Yes.
Yeah. Good.
Okay. Thank you very much.
You're welcome. Please, any other? Or we should sleep.
Take you to sleep.
All right. Also, I mean, sure. All right. So thank you very much for your cooperation. Please, just as somebody said, it's getting tougher. Please don't feel that way. Don't feel that it's getting tougher. You should, by this time, be appreciating Oski the more because you are getting the understanding better, isn't it?
Yeah.
Yeah.
Yes. So just fall in love with it and then go along with it, with the flow. Don't feel that it's getting tougher. Yes, it's getting plenty, put it that way. But to make sure that you are at par with whatever flow we are moving at, please don't power them, just as I keep saying and shouting every day. Hmm? I know why I keep saying that. Don't power them. Hmm? At least we meet some intervals, isn't it? Maybe sometimes we have 3 days, 4 days before we meet, isn't it? You
Yeah.
can use those days, revise the previous ones. It's just 2 hours meeting, isn't it? Play, revise, do some research about what we learned, understand it better. If you don't understand anything, we have a group, put it in there, ask questions. This is your life. So anything you don't understand, don't suppress it. Because if you don't let us know, we will not know you that you don't understand. Do you understand the point? So ask anything you don't understand, because there's nothing like simple thing in OSCE. Or how do I put it? Small thing. Because looking at the feedback we read, there are something we say simple, simple, isn't it?
Yeah.
Good.
Yes.
But that's what is causing failure, because they are very crucial. So please, if you don't understand anything, if you are struggling with anything, please don't hesitate to put it in the group. We are there for you. And then don't sleep until you have passed.
Mhm.
All right. If you have not booked, please motivate yourself and book. Find a date.
Mm.
It's also
Yeah.
another thing. Please, those who are forming study groups, make time for yourself and discuss. Okay, it is very good. We are in this together. Mm-hmm.
Yeah.
I have a question.
Hey, I can. Mm-hmm.
It's not related to the class though.
What is it related to?
It's not related to the class, but then there is this news going around that there's been a himpo. Almost say just this whole the recruitment issues and blah blah blah.
There's no recruitment issue.
Oh.
There's no recruitment issue.
Nyanto, please. Sorry. So with the implementation station, is it only medication that you be asked to administer?
Yes, so
Or you
implementation
ask
is
questions
administration
based
of
on
oral medication.
planning that you did?
No, only medications, just as we did.
Mm.
Exactly.
So
Me
even in the
patcho my
nursing care plan that
mentor.
okay, you finish. I'll put it in the page.
My minimum there now so
Okay. Yo.
So with the planning that you do, the nursing care plan, if okay, yeah, there would surely be administer medication. I get it now. Thank you.
What you said, I didn't get, but if you get it, fine.
I was thinking that
Okay.
the implementation questions are gotten from the care plan that you do you present to the assessor. So I was going to ask that during your care plan, if you've not stated that administer prescribed medication, maybe the nursing care plan that you wrote, there's no point that indicates administer medication. Would they still ask you to administer medication in the implementation, or they'll ask you questions based on the care plan that you wrote? That's what I was trying to mean.
No, they were not based on anything. Implementation. Exactly. It's a different station on its own. Okay.
Okay.
For clarity, for incomplete prescription, do we feel verbalize that to our patients as well?
Yes. So anything you are doing, you need to explain to the patient. Okay. So you can tell the patient that, oh, you have salbutamol prescription, but I'm not happy to give because the prescription is incomplete, in the sense that
Oh,
there is no prescriber signature.
oh, okay.
So anything you are doing, that's why it says read out the chart, explain what you're doing, telling why you are not giving. Hey, what am I saying? Yes. So it says what? Read out the charts and explain what you are checking, giving, not giving, and why. So anything you are doing, talk to your patient. Exactly.
Thank you.
Gentle.
Yes, madam.
No me say. And I know young crowfoy and in them news say almost in crowfoy say omo ba be shut it down. Care visa route to know.
Are you a carer?
Oh, okay. No.
Nurses are untouchable. Listen,
Oh God.
whatever you are doing,
Oh,
keep on
serious,
doing.
because
So
grandma president no so no say Ndra say anana ya no pawe. Another a year but so some kofo de mama yet ha na ye yem hihia na
no, there's
hihia
a
yo.
difference between
There is a difference between a career and a nurse.
yes, vast difference. Okay, even the IR thing that they are saying they are taking it to
And
10 years. Nurses are exempted.
yes,
Doctors
they
are exempt.
stated nurses, doctors, technicians, engineers are
So
exempted.
there are two different things. So though nurses and other healthcare workers are all on the skilled worker visa,
Hey, I
but
can't
then
hear anything. No.
we are saying that nurses and all other healthcare workers are all on the same visa, the skilled worker visa. So under the skilled worker visa, we have different types of what visas. We have the social care, and then the one for the nurses at different levels. So when they are talking about carers, or they are talking about care workers, it's not nurses. They are talking about carers that works at the care home, like we all know, some of us know, but it's not nurses. So when they say care workers, they are not talking about nurses. When they want to talk about nurses, they will say nurses. Please, is that clear? So the
Thank
news
you
that
very
is coming
much.
is not for nurses, it's for care
Okay.
workers that they gave the opportunity somewhere in 2020 to join the occupational shortage list. So they are
Okay.
different set of people. Mhm. These people can never
Okay.
do away with nurses, especially international nurses. If you come to our world, we are about 40 something nurses. Mind you, there are only two British.
Wow.
A world of 40 something nurses, only two British, pure white. The rest of us are Asians, blacks, blah 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 blah. So if you say all these people to go home, America too to look after who? So there's no way these people can do away with what high skilled professionals. So what they are dealing with this time is dealing with what low skilled professional. Let me put it that way. Because when you come to the visa category, they have levels. So we have the RQ115 going. That's where nurses and engineers fall under. So this restriction that they brought, it starts from those below 3. Do you understand? At first, they were not giving the dependents to those below 3. That is care workers, senior carers, and all those stuff. But when Rishi Sunat came, they extended it to all those people. So that's why people came in from 2020 to the 2024, and they realized that people were abusing that visa, and then they increased the salary threshold. So even if they increase the salary threshold, it will never touch nurses. Currently, they pay the salary threshold for someone who can bring a dependent to, is it 26,000 or something? An average nurse, band 5 nurse, takes 29,000 a year. So it's never affected the nurses. That is why nurses can still bring what? Dependent, but carers can't. Do you get the point? So
Yeah.
there are two different sets of people at all. So all this nama that is going on, forget about it.
Okay. Oh,
Okay.
thank you.
No.
Okay.
Good night.
Oh,
Good night.
say just a minute.
Mm.
When you were talking about the medication, you kept on saying codes. Is it on the page? I can't find the codes.
Yeah, the code is on the chat. You were sleeping at that time. May God forgive you.
No, I wasn't sleeping. I was following, but I can't see where the codes are.
Second chat.
Hey,
Second
Is it
chat.
second or third?
the second page, I think.
Yeah, second page.
Oh,
I
okay.
sent it into the group. You can have a look. So this page, these are the codes. I even embodying it when we're discussing. That's why you were dozing. I forgive
Oh,
you. Don't
okay,
worry.
okay, okay.
Everything.
Yes, yes, yes. Okay.
Thank you.
Thank you.
Oh, sorry, last question. It doesn't